Hello and welcome to this webinar, the first in a series showcasing the benefits of substituting hazardous chemicals and the tools and resources available to assist you. My name is Thierry Nico and I work for the Risk Management Implementation Unit here at ECHA. I will be your moderator for today's event. So why opt for substitution? There can be several reasons for companies to opt for substitution. For instance, when existing processes need to be improved, companies may choose to innovate and look for alternative substances or techniques. Gaining a competitive advantage by producing safer products can also be a strong driver for substitution. Substitution can result in substantial benefits for the company itself and also for the human health and the environment. In terms of regulatory drivers for substitution, the REACH, CLP and biocidal products regulations are amongst the most prominent ones currently driving companies to substitute hazardous chemicals in Europe. The aim of this webinar is to introduce you to the substitution process through real business cases. They showcase how substitution can improve efficiency, drive innovation, help you gain a competitive advantage, enhance safety and save cost. Now let's move on to our first agenda item of the day, a quick overview of the substitution web pages which were published last week. These pages contain information on how to substitute in order to reduce the potential risk caused by a substance and highlight the alternative assessment frameworks and tools that are available to support you. You can find these pages under the Regulation tab on our website. They are divided into 4 sections. The first, Why should I substitute?, gives information on the different benefits that substitution can bring to your company. The second, Do I have to substitute?, explains legal requirements for substitution and how substitution relates to other legislations. The third section, How do I do it?, is structured in 5 steps to help you navigate through your substitution process. It contains a wealth of information to help you substitute, such as links to different chemical databases and tools. The last section, Examples from real life, presents individual substitution cases where you can learn from the experience of other companies and get ideas for your own. We will soon expand this section with more case studies. Please bear in mind that the case presented on our website and during this webinar are for exemplification purposes only. They should not be seen as an endorsement or any kind by ECHA or as advocacy to switch to specific alternatives. After today's webinar, and together with the information you can find on our new web pages, we hope that you will be able to start considering whether substitution might bring benefits to your company and that you can find more information to get started. I will now give the floor to Mrs. Malene Blume from Coop, Denmark, one of Denmark's largest retailers, who will talk about their experience in substituting hazardous chemicals in their products. Mrs. Blume, the floor is yours.
Hello everyone, this is Malene Blume from Coop Denmark. First of all, I'm very pleased and glad to speak on this webinar today, and I hope you will find my presentation interesting. Just a few words about Coop Denmark. We are the biggest retailer here in Denmark. We have around 1,200 shops, and we have different chains from hypermarkets to supermarkets, but also a quite big range of discount stores. Around 30% of our shop is in the range of Factor, which is our discount store. We are owned by 1.4 million members. So we are indeed in cooperation established from around 150 years ago. We have a quite big range of private labels. Here you see the brand for food and daily non-food like cosmetics and detergents. We have Englemark, which covers the environmental friendly and allergy and organic products. Then we have the Coop platform, which is value for money. And then we have the platform called ECHA, which is a quite big platform and where all the discount and very cheap products are to find. We also have quite many private labels in what we call a real non-food. This is for electronics, textiles, bicycles, home textiles, home decoration, furniture, batteries, light bulbs, and so on. So we have quite many private labels also in what we call real hard goods non-food. And then a little more about how we work here in Coop Denmark. We have used quality requirements from all the beginning. We have always evaluated the situation, the legislation, the risk for the consumers and for the environment, and we set up requirements which goes above the legislation. One of the most important skills that we use, that is, we use the precautionary principle, because we want to be the first mover and want to secure the highest level as for safety for our consumers and for the environment. So we think that we are the biggest retailer in Denmark. We are owned by our consumers, and that makes us that we can make a big difference when we set strict requirements and use all the knowledge we have about the risk, and then secure that we are on the top level in all our private labels. And it's very important to note that our quality requirements for all our private labels covers all our private label, also including the extra discount rate. So even if you buy a liquid hand soap for less than €1, then it will always be covered also by requirements stated, which also cover the more expensive platform, the Engelmark. And how do we work with substitution? We have experts here in Coop Denmark, which are in deep cooperation with the authorities, with NGOs, and which to follow what scientists also are concerned about, following scientific evidence and so on, and they always evaluate and do the risk and perform the risk assessment and investigate the possibility for safe substitution. So when we find it necessary to use the precautionary principle, this is when we find there's a risk which are not covered for the consumers, and even better if there are some easy way to substitute this chemical. Then we can do it quite quickly, because we have more than 3,000 private labels in daily non-food and food, and many thousands of products that we import every year in non-food. So when we do adopt a new requirement, it will have a quite quickly impact on our products. So we identify a risk, have information for NGOs, from authorities, from scientific committee, from ECHA, for other, it could be ChemSec in Sweden, from REACH and everything. Then we know that legislation sometimes takes too much time. But we can move even faster because we have a direct dialogue with our suppliers. So our challenge is to identify the risk, and then the next challenge is, which is sometimes the hardest one, is to find out how do we substitute the chemical. And here we have a lot of help from experts and chemical consultants, and dialogue with all the help and the network that we can use. We attend different kind of network groups and committees, and we try to find information needed to take a decision for what to substitute to. And we also listen to our consumers. They can have some concern about a chemical. It might not be hardcore scientific proof that they are a risk, but if our consumers are concerned and there are some doubts about this chemical, this can also be a reason to substitute the chemical. Here you see example, the past 40 years that Coop Denmark has implemented requirements, and this is on top of legislation. We have, I think in the early 1970s, have a new platform Minirisk, which were allergenic friendly, maybe the first brand in the world. Then Coop always have a very high focus on hormone disrupting chemicals, because there's a high attention here in Denmark. We have a scientific research center here in Denmark, and they put this on the agenda. So we also have very high focus on this. So we were the first one in Denmark to ban, maybe in the world, to ban hormone disruption back in 2006, because we find there was a risk, and the use of precautionary principle were the right place to use here now. In 2005 we banned triclosan. Back in the 1990s we banned PVC for all packaging. Also in many product categories for furniture, footwear, bags, textiles, we do not want PVC because it's an environmental problem, and because it always contains phthalates, and if we ban PVC we also avoid most of the phthalates. The next step, the more strong position, where we banned the fluorinated compound last year, but also ban of a very allergenic preservative, methyl isothiazolinone, also called MI. But I will talk about this in the next slide. For the endocrine disrupting chemicals, the EDC, as said before, we had a very high focus on this. And this is also in a system with our consumers, because they are also very concerned about the impact on human health when you are in direct contact with these chemicals, which are under suspicion to be an endocrine disruptor and maybe can influence on the hormone system by the human. Back in 2006, it started and the discussion, and we decided, it was in fact in 2005, to ban all known EDCs, and we choose to following the EU's priority list for endocrine disruptors, and then we ban all parabens back in 2005. So we do follow this and also have a very high alert for the other chemicals which might be in the loop for having suspicious for this endocrine disrupting chemical. Back in 2005, we also banned triclosan because it's an antibacterial ingredient, and there was very concerned about developing multi-resistant bacteria, and that's why we banned it back in 2005. We don't find it necessary to use in private homes. It will be sufficient to clean and to brush your teeth very careful, and then you don't need this chemical which can harm your health and the environment. Triclosan ban is an example where we do not only ban it in our own private label products, but we also require from our suppliers that we will not accept this in all branded goods as well. But one product we could not ask to substitute, it was Colgate Total. They are not ready to remove triclosan from the toothpaste. But from some years ago, there was a storm, media pressure and storm again here in Denmark, and we asked Colgate to put on a label informing the customers that this product contains triclosan, and only to use if you have a sincere problem with parenteral. But this year we decided that we will be 100% triclosan free, and end of last year we did stop the buying in of it's called Colgate Total. This is the most famous toothpaste in the world, but we've decided to stop selling it, and today our shop are 100% triclosan free. Another example where we use the precautionary principle and follow extreme concern for the scientists, for the authorities, well knowing that a European ban will be some way, a regulation will have to wait for some years. We have been following discussion in Denmark for some years. The scientists sent out a statement in October 2013, extremely worried about the fluorinated compounds, which can be put into your body and it will never get out again, and it is combined with seriously health effects and also environmental problems. So we start to dig into this and made analysis and a mapping for Coop to find out what problem and where do we have use of these fluorinated compounds. There was also big attention here in Denmark. This is a picture in Danish, I'm sorry, but it just so it was a picture from a Danish newspaper showing all the bad things that can harm your body if you are having fluorinated compounds in your body. In 2014, there was again a television episode where they have tested many kinds of food packaging, and it shows that quite many food packaging do contain fluorinated compounds. It could be for pizza tray, it could be for microwave popcorn, it could be for dry cakes, muffins, and so on. And the experts which adopted the European requirements 10 years ago now realize that the tolerable daily intake, the TDI, might be up to 1,000 times too high. New analysis and new scientific reports shows that there's a risk today which are not covered by the level and the limits which are allowed today. And therefore we find that there was an urgent action needed, and we need to take care about this, because this is not it is not good that these chemical fluorinated compounds are used in food contacting materials and you will have it directly in your body. The picture you see here is the Danish Minister for Food Safety, and he said that he would like to ban these fluorinated compounds, and he will work as quick as possible to implement this ban. So what is the Coop approach to fluorinated compounds? In 2012 we banned it in non-food, in textiles. It's also used for water repellent for textiles, and we have found other solutions. In September 2014 we adopted a ban, a total ban for all paper for baking, muffin forms and paper for lunch bags and so on. No more paper and cardboard with fluorinated compounds in our shops. And this is also include where we have the bakery, the slaughtery, and other fast food products we sell directly in our shops. Could be French fries or burgers in paper. It should also be fluorinated free. We did a mapping for all our private labels. It took half a year. We have one product where there wasn't find a solution yet. This was microwave popcorn. We have forced our suppliers for half a year to find a solution. They could not tell us about the time limit. When do we have a packaging for the microwave popcorn without fluorinated compounds? And therefore we decided to stop selling microwave popcorn this May 2015. And I know this is a very, very dramatically action from Coop side. But we want to put as much as pressure that we can on our suppliers to find a solution. And after we did ban the microwave popcorn, a new scientific analysis showed shocking links for the fluorinated compounds in the blood and the risk for abortion. It was 16 times higher for abortion if you have a high level of fluorinated compounds in the female blood. And also a new report showed that when you breastfeed your baby, you will migrate, it will mean that all the fluorinated compounds will migrate into the baby, and it's a quite high level. So the scientific expert here maybe said that we had to take into account if we need to breastfeed our baby more than 3 to 4 months, because we see that the level of fluorinated compounds in the baby will rise dramatically. You can see on the right side, the red one is when you breastfeed your baby, and the blue one if you have only for milk in a bottle. So it took, in fact, a very, very high attention in Denmark. It was mainly 100% positive. It was a lot of television interviews, newspapers, radio, telling that Coop now banned microwave popcorn. And there was a very high pressure on our biggest competitor, Danish supermarket, that they have to stop selling the microwave popcorn. The Danish supermarket continues sales of microwave popcorn with hormone-disrupting chemicals, and the line owner said Coop will now save the customer for these hazardous chemicals in this packaging. So it was mostly positive feedback, and all experts, NGOs, and authorities did support us in our action. It seems also to be a commercial success because we had a very good, strong position, and also strengthen our brand. We have a research how much this all these advertisement did support Coop's name, and it was counted to be more than €1 million in value of branding and announcement. And most important of all, when we stopped selling popcorn, we really wanted to put a very hard pressure on our suppliers to find a solution. And it seems it had worked because they really started very quickly. There was no one in the world when we stopped selling popcorn which had found a solution. But now we have heard that a solution can be ready in the near future. So I think it was a very important action that Coop takes because we put the maximum pressure on the suppliers to find a solution. And I think it was a positive story, and we have not had any negative feedback on this action. Another example for using the precautionary principle and also push our suppliers of branded goods like L'Oreal, Colgate and so on. This is an allergenic preservative used in personal care products. It's called MI. Allergy experts in Denmark and in Germany say that there's an explosion of new numbers of allergenic problems for humans. And if you first have this allergenic, you will have it for life. Coop have never used this in our private label for detergent and for cosmetics and personal care because we used the early warnings 10 years ago, and so they had a bad profile. It could be a potent allergenic substances. For 2 years ago, the Danish authorities raised the alarm. There was an explosive number of new allergies. It was the end of 2013. In January 2014, Coop decided to withdraw Huggies Baby Wipes. It's a branded product because this was the only one in our baby products which did contain MI, and we decided to take it back from our shop to cover the risk for the babies. There was many problems about very small babies having sincere problem with allergy for this chemical. At that same time, January 2014, we informed all suppliers of branded goods, cosmetics, all the big leaders in Europe, that we will not sell the personal care products with MI in the near future. So please substitute it as soon as possible. So they have been challenged. We have challenged them about this, and now in 2014, we can say that all what we call leave-on products like body lotion, like antiperspirant, like face cream and so on, are now 100% free from MI and also cover the hair styling products. So this is also an example where we do also push the supply of branded goods to cover the risk for our consumers. The next very important action from Coop is to tell more about our action and our attitude towards harmful and suspicious chemicals. We have not been very good informing this to our consumers. When we talk about this, people say, why don't you, Coop, tell about this? Because we are concerned. We read about daily use non-food products which can cause sincere health and environmental problems. And Coop, you do not tell about that you work in the head office and try to develop the most safe products as possible. So finally, we have set up a new chemical strategy. We have made a frame for our work, and now we have made it possible to communicate this to our consumers. And this is really, I'm really proud of this. I'm very happy for this, because then we can hopefully also gain the commercial advantages of our position in this field. When we inform this to our consumers, are they concerned of something, they know they can go into Coop, and we have hopefully been a front runner and cover the risk that we know about, and try to secure that the products are as safe as possible. We have identified 12 kinds of chemical groups in everyday products, and we have said that by the end of 2017, Coop will work to ban of these 12 chemicals in our own private label products. And the next step is that we try still to push the suppliers of branded and famous products to phase out the chemicals which we find necessary. It could be use of precautionary principle, or else if the legislation is too slow, and hopefully the branded goods will follow our example. We are the biggest retailer in Denmark, and when we do say stop buying some products, it will indeed have a big impact for the suppliers in Denmark, even if we are not big in more European perspective. We have, in this Monday, we have put an announcement in all big newspapers in Denmark informing that this is about the case about MI. It says that it could take several years before the European Union ban substances on a very high concern in cosmetics. And we say this is, how is translated, this is, that can make your skin red. This is also a word saying that this is really annoying. And that's why that is why we take action by ourselves and ban all deodorant, body lotion and other cosmetics products with this high allergenic preservative MI in our shops, and also account for branded goods. And then we inform a little more about our chemical strategy. So right now we have informed this to our consumers about our chemical work, and here see you all the 12, the dirty dozen, from MI to fluorinated compounds to hormone disrupting chemicals in cosmetics to PVC and phthalate to textiles to the candidate list from the REACH and SVHC for the perfume and allergenic preservatives in detergents and personal care for triclosan, for cleaning products with antibacterial and disinfectant with chloride and cationic tensides and the pesticides. And the last one is detergent. And in the top you see bisphenol A, which also is an endocrine disrupting chemical. So we hope that when informing this more concrete to our consumers, we have now a frame. We have now the full organization supporting this. So this will be a high attention in the coming years from the side of Coop. And I hope it will also tell our buyers and our organization that we can also see that we have higher loyalty, maybe have a higher commercial advantage by still keeping these requirements for our private labels and for products in our shops. So many thanks for listening, and please ask questions if you like. Thank you so much. I really enjoyed to be here. Thank you.
Thank you, Mrs. Blume, for your interesting presentation and how substitution contributed to strengthening your brand. I'm sure our audience found it useful. Next, Dr. Carla Pfaff from the German Federal Institute for Risk Assessment will share their experience of monitoring a voluntary agreement across the entire value chain in Germany to replace certain types of phthalates in the paper industry.
Hello to everybody. My name is Carla Pfaff. I am working at the German Federal Institute for Risk Assessment in Berlin, and in our institute I am in charge for the evaluation of food contact materials. With my presentation I would like to give you a report on our efforts in the phase out of diisobutyl phthalate in food packaging made of recycled paper and board. The substance diisobutyl phthalate was for a long period of time used as an plasticizer in dispersion adhesives. These adhesives has been used, for instance, in making folding boxes and corrugated board for non-food applications and also in print products. An authorization of the substance for use in the manufacture of food contact material was not granted. The substance is highly insoluble in water. The cleaning processes in the paper recycling mainly are done by washing the fibers with high amounts of water, but this way the substance cannot be removed efficiently from the fibers and can finally also arrive in paper and board for food contact. The substance transfers mainly via gas phase from the packaging material into food due to their lipophilic properties. Mainly fat-containing food are concerned, but always if gas phase transfer is involved, it is in particular food with a high specific surface which is affected. This means food in powdered or fine-grained form, like for example rice, flours or other baking mixtures or breadcrumbs. The starting point of our activities have been information we have got from laboratories of the official food control authorities. In 2007, they asked us for a risk assessment on finding on DIBP in food packed in recycled paper and board. The colleagues from the food control laboratories had tested 78 samples. Thereof 48 samples revealed more than 0.3 milligram DIBP per kilogram, and 10 samples had a content above 1 milligram DIBP per kilogram. These 10 samples are listed in the table in this table. You can see that the highest amount determined was 5 milligram per kilogram of food. Also the packaging materials have been analyzed. In this graph the results are compiled. You can see here that amounts up to 600 milligram DIBP have been measured in paper and board. For the toxicological evaluation of this amounts of substance in food, the data necessary have not been available in case of DIBP. The European Food Safety Authority has made an evaluation of several phthalates in 2004, and the DIBP was classified into a list of substances for which no or only scanty or inadequate data were available. The EFSA has also done a toxicological evaluation of the butyl phthalate, the N-butyl phthalate. This was based on an application for the use of the substance in food contact plastics, and in such an approval process the petitioner is obliged to provide toxicological data, so that EFSA could finally derive a tolerable daily intake of 0.01 milligram per kilogram body weight for this substance. This TDI is based on the lowest observed adverse effect level of 2 milligram per kilo body weight and day, and making use of an uncertainty factor of 200. The pivotal toxicological effects have been developmental effects. In our risk assessment, we made use of this evaluation. In first instance, we derived a transitional guidance value for the IBP in food, packed and paper and board in order to give industry the chance to change the situation and to make a corresponding efforts to reduce the burden of the recycled fibers with this substance. We applied the TDI derived by EFSA for the N-butyl phthalate and made use of an allocation factor of 50% for the exhaustion of this TDI by the transfer from food contact materials, because it is known that there are also other sources of exposure for this substance. We assumed a body weight of 60 kilogram per person and a daily consumption of 300 grams of fatty food and food with large specific surface, which was packed in paper and board made from recycled fibers. This assumption led to a limit of 1 milligram diisobutylphthalate per kilogram of food. In case of food for babies and infants, a limit of 0.5 milligram per kilogram was established, because for this group of consumer a higher daily food consumption related to the body weight has to be assumed. In our assessment, we deviated from the default values which are used for the derivation of migration limits for substances migrating from food contact materials into food, in particular for the amount of food consumed on a daily basis. There an amount of 1 kilogram per person is assumed, and this would then lead finally to a limit of 0.3 milligram per kilogram food. And this was from the beginning on our final objective, but we felt that it was necessary to have a transitional period. In this process of evaluation, we took also note of the classification of the substance in European chemicals law. It was of great help for us that the substance was identified as a substance of very high concern in 2008. The discussion started already at an earlier point of time, and the substance was finally also included in the candidate list for SVHC substances. And also by the regulation on classification and labeling, the substance was classified as Reprotox 1B. And finally, it was also added to Annex 14 of the REACH regulation. Until now, there is no request for authorization. The sunset date was in February this year. The use of recycled fibers also in the manufacture of food contact paper and board is very important, and therefore there was an urgent need to change the situation, and we started in discussions with the industrial associations concerned. This had mainly been the manufacturers and processors of paper and board, of print media and adhesives. This was done in a close cooperation with the German Federal Environment Agency, which of course was also highly interested in the protection of recycled fibers as a raw material. Together we suggested to industry a voluntary commitment to waive the use of DIBP in adhesives, printing inks and other products. Also the interest of the industry was great, especially of the paper makers. So they organized this initiative for reduction of DIBP in paper and board. A corresponding declaration was signed in November 2007, and it was joined by 9 industrial associations involved in the process. This initiative was addressed to our institute and the Environment Agency. The content was that a declaration that no products, in particular adhesives, should be used which contain diisobutyl phthalate, that reports should be given on the measure taken, including analytical findings in production control and in final articles, and that the authorities should be informed also on trends in the disposal of DIBP containing adhesives. The aim of this initiative was the reduction of the transfer of diisobutyl phthalate from recycled paper and board packaging into food to 0.3 milligram per kilogram until 2010. This initiative was also supported by the laboratories of official food control. They agreed to survey the effect of the measures by additional analytical controls of food and packaging materials. The results of these official controls had been reported to the both authorities each 6 months. In this graph you can see the combination of the results of the 5 first reporting periods. It was for all involved parties surprising how rapidly the concentration of DIBP in the food contact paper and board, and then also in the food, declined. Already in the 3rd reporting period, there have been nearly no samples exceeding the provisional limit, and in the 5th reporting period there have been no sample at this contaminated at this level, and more than 90% of the samples did already meet the final level of 0.3 milligram per kilogram. So we could gladly think that this was a very successful exercise. We could see a rapid reduction of DIBP in the food concerned. This process was, of course, and highly supported by the identification of DIBP as a substance of very high concern and its inclusion in the candidate list. And we finally implemented in our recommendation 36 on paper and board for food contact a guidance value for the transfer of DIBP into food from recycled paper and board of 0.3 milligram per kilogram. This limit was expressed as the sum of DN and diisobutyl phthalate, because for both substances the same toxicological endpoints had to be taken into account. Unfortunately, this positive picture was compromised by a further surveillance project which was performed in the years from 2010 to 2012. The Federal Ministry of Nutrition, Agriculture and Consumer Protection has issued a project in which the migration of unwanted substances from packaging materials made of recovered paper and board into food was investigated. This project did also involve the so-called 119 sample study. This food sample had been tested for several times over the whole storage period, and the final testing was in August 2011 at the end of the best of date of the samples. Unfortunately, the results of this investigation showed that nearly 25% of the samples tested exceeded the limit of 0.3 milligram per kilogram, in part with very high amounts. The maximum was determined at about 35 milligram per kilogram. In addition, 7 further samples exceeded the level of 0.3 milligram per kilogram if the sum of DIBP and DBP had taken. So this was a little bit disappointed, and we have to say at this point of time that DIBP can no longer use in Europe. Could only be used if an authorization was applied for and granted, but it has to be taken into account that the trade with recycled fibers and with recovered paper is a global business, and the possibility of contamination of the recycling loop by packaging materials imported from third countries cannot be excluded, so that it is not possible to have the input material for the recycling processes under complete control. At the moment, we try to establish a new surveillance project together with our colleagues from the official food control laboratories in order to get up-to-date data on DIBP in food which was packed in recovered paper and board. And I hope that this will then show a better picture. And with this, I thank you for your attention and I am open for further questions. Thank you.
Thank you, Dr. Pfaff, for your presentation. It shows that with the commitment of several actors, substitution can also be realized on a large scale across the entire value chain. Our last speaker of the day, Dr. Joel Tickner from the University of Massachusetts, Lowell, will describe the US approach to substitution, which, although done quite differently compared to Europe, has many similarities and learning opportunities for the European industry.
Well, good morning, everyone. My name is Joel Tickner. I'm a faculty member and researcher at the University of Massachusetts at Lowell. I'll be talking this morning about the approaches to substitution in the United States, and a little bit of history of our work on substitution here. So what I'm going to cover is the drivers of substitution and the focus on alternatives assessment as a way to lead towards informed substitution of chemicals of concern, and this growing field and some of the lessons we've learned from our approaches to alternatives assessments over the last 20 years. As we know, there's many drivers for chemical substitution, and in Europe those are primarily regulatory drivers such as the REACH regulation and directives such as the restrictions on hazardous substances directive, but we have increasing drivers in the United States such as the California Safer Consumer Products regulations and policies such as those in Maine and Washington on children's safe products. However, in the United States, we see a much bigger driver coming from the marketplace. Major retailers and brands, such as in the footwear and apparel sector, are pushing their supply chains because of consumer pressure to remove chemicals of concern from products. We see this in numerous sectors, including the building sector and the healthcare sector as well. However, one of the major concerns about chemical deselection is the idea of regrettable substitutions. And we've had numerous examples of regrettable substitutions where the marketplace pushes a chemical out of the marketplace and substitutes happen that may not be safer. They may actually be as problematic as the ones we are substituting. For example, substitution for bisphenol A, which was removed very quickly from bottles, baby bottles and drinking bottles, was bisphenol S, which is a similar compound. Same thing with flame retardant replacement and replacement for a chemical called methylene chloride with another chemical called N-propyl bromide, which is a strong neurotoxicant and equally potent carcinogen. To avoid regrettable substitutions, we've moved in the approach of what we might call alternative assessment, and we'll talk about that in a minute, but it has a long history in the United States dating back to pollution prevention in the 1990s. While the focus in the 1990s was very much on process chemicals, we looked at tools for evaluating alternatives that would reduce both waste and toxicity in manufacturing processes. Coming into the early 2000s, we saw an increasing focus on chemicals in everyday products and the development of tools to evaluate the hazards of alternative chemicals for use in everyday products. And a number of tools were developed, such as the green screen and others, that help support this idea of evaluation of chemical alternatives. We saw in the United States increasing attention to tools and processes that consider exposure and particularly life cycle. For example, in the state of California, under the Safer Consumer Product Regulations, companies evaluating alternatives must consider life cycle attributes of those alternatives. And we also see increased focus on the applicability of alternatives among a range of companies. So it's not just about evaluating all the alternatives, but making sure that those alternatives work in particular processes or products. So we see a number of evolving efforts in the last 10 years from our Occupational Safety and Health Administration developing a toolkit for employers on transitioning to safer chemicals, our EPA Design for Environment program developing alternatives assessment frameworks, and a safer choice label that provides assurance that chemicals in those products are safer for their intended functional use. Tools such as the green screen, and states such as Massachusetts undertaking extensive alternatives assessment for chemicals of concern. Lastly, in 2014, the National Research Council of the National Academy of Sciences published a framework to guide chemical alternatives. Many of these tools are housed in a database collected by the OECD it's called the Alternatives Assessment Portal. So let's define alternatives assessment. Alternatives assessment is a process for identifying and comparing potential chemical and non-chemical alternatives that could replace chemicals or technologies of concern on the basis of their performance, hazards, and economic viability. So alternatives assessment is an action orientation. So there is a chemical of concern for whatever reason, whether it's scientific, market, legal reason, and someone or a company or a sector or a government agency is trying to identify alternatives to substitute that chemical. The goal of alternatives assessment is what the EPA has called informed substitution. And this is important because it really is about a considered transition from a chemical of particular concern to safer chemicals or non-chemical alternatives with the goal of minimizing the likelihood of unintended consequences. And because alternatives assessment is action-oriented, the goal here is really to enable a course of action based on the best available information that is available or can be estimated. So the goal here again is get the best available information to inform the transition to safer chemicals. So the focus of alternatives assessment really is a series of steps. It's action-oriented, and it may require several iterations. It's a continuous improvement process. The starting point for alternatives assessment isn't the chemical of concern, really the function that chemical provides, whether it be degreasing, whether it be flame retardancy, whether it be stain resistance, and then really focusing on how do we reduce the impacts, both the intrinsic exposure and the intrinsic hazard of that chemical, and considering the necessariness. Is that chemical necessary for a particular function, or is the performance overprescribed for that particular function? Again, the second part of this is really the adoption. So identifying an alternative through alternatives assessment isn't the same as getting it adopted in the marketplace, which is another challenge in the process. So just as an overarching framework, we think about alternatives assessment again as a stepwise process that involves engaging stakeholders as a first step engaging both those who are manufacturing the chemical, those who may be have concerns about the chemical alternatives, and obviously the whole supply chain, because they understand the chemical, they understand the manufacturing processes and the adoption. Defining the goals of the assessment, prioritizing particular uses of a chemical of concern for substitution, identifying and prioritizing those alternatives. Some alternatives may not be viable because either they are also chemicals of concern or they're technically not feasible. We compare alternatives, we select an alternative, and then we adopt those alternatives. The National Academy of Science, or the National Research Council of the National Academy of Science, developed its framework, which really pulls together a number of frameworks in alternatives assessment into an overarching approach. Now, this is a very big approach that the Academy has developed, and one thing they've said is that many users may need technical or data support to be able to implement this framework. But again, it's a stepwise process that starts with identifying a chemical of concern, scoping it and setting your problem, setting the boundaries around your problem, identifying those alternatives. If there aren't any viable alternatives, doing research in green chemistry solutions. So often there are not viable alternatives, and at that point we want to make sure that we're developing the next generation of alternatives, evaluating those alternatives for their physiochemical properties, their hazards, and the comparative exposure. So how does exposure change between one alternative or another? Does it modify the hazards of one alternative, or does it shift risks from one alternative to another? Integrating that information, then conducting a life cycle thinking experiment, so really understanding, are there potential trade-offs through the life cycle of that chemical alternative, and if necessary, to conduct a life cycle assessment. And then lastly, there's a comparison step and an implementation step. So again, a very generic framework, but again, stepwise, iterative, and flexible. So this is a key part of alternatives assessment, is being able to adapt the assessment to the particular decision-making context. What the Academy said was, very importantly, that alternatives assessment is a process for identifying, comparing, and selecting safer alternatives, and really has the goal of facilitating the informed choices between those alternatives. However, an alternatives assessment is not a safety assessment. It's not about setting a safe level of exposure, and it's not a risk assessment or a sustainability assessment. Again, the alternatives assessment is really focused on comparing those alternatives and choosing the best alternative for a particular function. This doesn't obviate the need to do a risk assessment later on to make sure that that alternative is indeed safe, because the safest alternative for a particular function in some application may not be a totally safe chemical, and you need to do the risk assessment. Again, if there are no good alternatives, we would engage in research and development on green chemistry solutions. From our perspective in Massachusetts, a key part of alternatives assessment is really the adoption phase, particularly for small and medium-sized companies. These companies often don't have the resources to do a detailed assessment, and certainly don't have the resources to do performance assessments and adoption assessments. So what we've learned through our program in Massachusetts is that key to adoption of alternatives is really to support the capacity of firms to adopt those alternatives. So in Massachusetts, we have a law called the Massachusetts Toxic Use Reduction Act, which requires that manufacturing firms every year understand chemical use and how chemicals flow through their facilities and get turned into product or waste, and every 2 years to undertake a planning process to understand what options exist to reduce their use of toxic chemicals and their generation of toxic chemical waste. They pay a fee on those chemicals that supports a voluntary technical assistance program and a research and education program at my university, the University of Massachusetts at Lowell. So our Toxic Use Reduction Institute at the University of Massachusetts at Lowell undertakes support programs for companies, including research on alternatives, technical evaluation of alternatives, education and training, and demonstration sites and supply chain partnerships. For example, in response to the European Restrictions on Hazardous Substances Directive, the Massachusetts Toxic Use Reduction Institute worked with electronics firms to support testing and evaluation of alternatives, lead-free electronics alternatives. We're doing that as well with hexavalent chromium in the aerospace sector, and we're doing it as well with perchloroethylene in the dry cleaning sector. So that kind of support helps firms to overcome the barriers to adoption. So it's great that we can evaluate those alternatives, but really change happens when we adopt those alternatives. So as an example, in Massachusetts, one of the main chemicals that we report on is trifluoroethylene in degreasing operations. So what we did at the Toxic Use Reduction Institute, we worked with small metal finishing companies to evaluate the performance and the toxicity of alternatives on their own equipment to identify where there are better alternatives and make sure that those function at a technical level. And as a result, we were able to support the reduction of about 95% of trichloroethylene in Massachusetts, saving industry millions of dollars, but also helping to overcome the barriers to adoption of those safer chemistries. We've just finished, and actually just published last week, a review of alternatives assessment frameworks. These are frameworks across Europe and the United States to help support companies and government agencies in evaluating and adopting safer alternatives. What we've learned from these, many of them are from government. They're guidance documents, such as the ECHA guidance document on authorization and chemical substitution. What we've learned from them is that alternatives assessment is growing, it's robust, it has evolving frameworks, methods, and tools. There are many commonalities between the approaches in different alternatives assessment frameworks, but some important differences, for example, in how exposure is addressed, how risk is addressed, and how different toxicity endpoints are addressed. So we really do need greater consistency in alternatives assessment at a global level. But there's also an important need for enhanced, readily available data for conducting alternatives assessments, data that can be used, for example, by small and medium-sized companies that don't have toxicological resources to conduct detailed alternatives assessments. And we understand that the field, the growing science policy field, would benefit from greater cross-sectoral collaboration and sharing of data, knowledge, and case examples. Let me explain a little bit some of the differences in approach between the U.S. and the EU in alternatives assessment. As I said, the U.S. alternatives assessment has primarily been driven by market forces, much less by regulatory or policy forces. In the European Union, it's been much more driven by policies, both in the environmental and in the occupational safety and health field. In the U.S., we focus very much on the assessment processes. We want to avoid regrettable substitutions, so we focus a lot on detailed guidance on how to actually conduct an alternatives assessment, and we focus both on the assessment and the implementation, particularly at the state level. The European Union focus has been much more on the outcome, making sure that that substitution happens. Our focus in the United States has been much more coming out of the pollution prevention arena, so that tends to be a hazard focus, not a risk focus, which has been more the focus in Europe. We're expanding because of policies, for example, in California, to a much broader approach to alternatives assessment that considers life cycle, performance, etc., whereas the European approach is primarily focused on risk, economics, and performance. We tend to have a much more prescriptive approach to alternatives assessment, very detailed guidance on how it should happen, and the European approach has been much more focused on making sure the action happens. In the United States, we've done many more government alternatives assessment and some industry assessments, and in the European Union, it's been much more done by industry rather than government doing these assessments, with some exceptions at the member state level. So what are our research needs going forward for alternatives assessment? We need to get some consistency in what hazard endpoints and what criteria for those hazards we're evaluating. We need much better ways to integrate data across data types, for example, and to fill in data gaps we might have. For example, how do we build in information from traditional toxicological research, high throughput screening, and structure activity screening to better understand chemical hazards and the trade-offs that might happen between one alternative and another. We need better ways to rapidly understand exposure to identify potential trade-offs. We need tools to integrate life cycle thinking into alternatives, because sometimes our alternatives may not be chemical alternatives. They may actually be materials or process change alternatives, and how do we compare those more effectively? We need some consistent approaches to evaluate economic and performance assessment. And then how do we more effectively bring together information from multiple attributes, from performance, from economics, from hazard, and identify the best available options? Again, we're trying to build towards quality and relatively consistent. We're never going to get perfectly consistent assessments, but relatively consistent assessments so that we can compare them and identify and evaluate the quality of them. So what are our lessons from the United States? Our lessons are alternatives assessment needs to be solutions-focused and action-oriented. We need to avoid paralysis by analysis. So the goal here is really excellent action and not excellent paperwork. Often our assessments do not follow the same timescales as business decisions. This happens often in the risk assessment process, that decisions in business happen much more quickly because the marketplace moves much more quickly often than science moves or government agencies move in their assessments. So we need tools to inform decisions, to inform substitution decisions that are efficient, context-dependent, and lead us to better decisions. It needs to be flexible and iterative and open and adaptable to different contexts and different users. We need tools. We need many more tools to help support the rapid evaluation of alternatives given those time frames that we often work in. We have to be comprehensive in our choice of alternatives, right? We have to think about broadly about both chemical process and material alternatives. And we have to have an open and comprehensive scope, an inclusive and transparent scope. So transparency is very key in an alternatives assessment, as it is in almost any scientific discipline, so that someone can go back and see what assumptions were made, what was the scope of the number of alternatives considered, what were the limits or the strengths of that assessment. It's important here to focus on both assessment and adoption. A good alternative from the assessment side may not be a good alternative at the adoption phase, or adopting that alternative may lead to some change in a process chemistry or a process that may have risk trade-offs in and of itself. So we need to focus on both, because if the goal of alternatives assessment is to support informed decisions or informed substitution, we need to make sure that we're actually informing those substitutions and making those substitutions happen. We need to support innovation in and new chemicals and materials development, because often the alternatives may only be a small step better or not even better. So we need to link alternatives assessment to research in safer chemistry or green chemistry. We see a lot of opportunities to start building this field moving forward for better US-EU collaboration on chemical substitution and developing the science and the processes, the practical application of alternatives assessment. Just a number of resources we found very useful from our institute, from the EPA, from the OECD, and of course in Europe there's the Substitution project, which was set up specifically to provide resources and tools to support informed substitution. So there are a number of resources and supports out there for industry to engage in alternatives assessment. And here's some more information on our work, and thank you very much. And we welcome you into this ongoing discussion on how to improve and support chemical substitution so that we do move towards more sustainable chemistry. Thank you very much.
Thank you, Dr. Tickner, for showing us the American way on substitution. We can definitely learn from each other, and we are pleased that you took the time to share your experience with us. That's about all the time we have for today. I hope you found the webinar useful. Thank you to all our panelists and presenters, and most of all, thank you to all of you for joining us today. A link to the recording and presentation will be sent to all of you shortly after the webinar. Our next webinar on substitution will take place in December. The topic will be how to substitute successfully, and it will focus more on practical examples and case studies from individual companies. When the webinar closes, you will be automatically redirected to a short feedback questionnaire. Please take the time to share your comments and suggestions with us so that we can further develop and improve our webinars to meet your needs. And see you again in one of our upcoming webinars. Thank you and goodbye.